You are welcome to my YouTube channel. The topic of discussion is diagnosis and treatment of onchocerciasis or river blindness. In a previous video, the etiology and clinical manifestations of onchocerciasis were treated. So, looking at the diagnosis, there are two types of diagnosis. You have clinical diagnosis based on the observations made by a medical doctor, and then you have the laboratory diagnosis. So the clinical diagnosis of onchocerciasis is based on the observation of persons that are living in endemic areas who have subcutaneous nodules. These are firm, rubbery, palpable nodules, and which the medical doctor can examine, and also cutaneous manifestations such as the presence of depigmentation, what is described as leopard skin, and also the thickening of the skin, and also ocular manifestations. Ocular manifestations involve the presence of photophobia, that is, the infected person cannot really look at light, and also lacrimation, that is, increased outpouring of tears from the lacrimal glands. These are some of the ocular manifestations. Then you have the Mazotti reaction, or the diethyl carbamazine provocative test. This is simply the administration of 0.5 milligram per kg to 1.0 milligram per kg of diethyl carbamazine. Following the administration of this medication, reactions observed, such as exacerbation of the pruritus or itching, as well as the dermatitis, is suggestive of onchocerciasis. Then you have the laboratory diagnosis of onchocerciasis, which is simply made by detection of microfilariae in skin snip, which this is the gold standard. It means that a blood-free skin biopsy sample must be obtained using the corneal scleral punch. And this skin snip is placed in saline on a glass slide, or in tissue culture medium, or a flat bottom microtiter plate. And this is incubated for 2 to 4 hours. It need be, after this incubation, slides can be prepared and observed under low power microscopy, and emergent microfilariae can be seen. But if no microfilaria emerges, then the incubation should be done overnight and then observed by using low power microscopy. A serological detection of antibodies to Onchocerca volvulus can be done using the principles of enzyme-linked immunosuppressant assay, the assay to detect IgG4 antibodies to OV16 antigen of Onchocerca volvulus. Also, the detection of Onchocerca DNA in skin snip can be done using the polymerase chain reaction PCR. This is usually done in specialized laboratories, and PCR is highly sensitive and specific. Look at the treatment of onchocerciasis. This involves one, nodulectomy. Nodulectomy is the surgical excision of these nodules where they are accessible, especially on the head, because of the proximity to the eyes. So nodulectomy helps to remove the nodules, because the nodules contain the adult worms that adult worms, particularly the microfilariae, are produced by the female worm, and they are the ones that are ingested by the insect vector Cymeleon. Next is the administration of ivermectin, which is important. Chemotherapy is the mainstay in for the treatment of onchocerciasis. So ivermectin can be given annually, and it's a microfilaricide, that is, it kills the adult worms, and particularly stop the production of the microfilariae by the female adult worm, given in a dose of 150 grams per kg the body weight. Then the deoxycycline can be used also, can be administered to eliminate the endosymbiont Obachia species that are found, or that is found in the female adult worm, that is the female adult Onchocerca volvulus. A 6-week course of deoxycycline will eliminate Obachia species that are now known to be responsible for the inflammatory process that lead to blindness. Thank you for listening.